Hello, I would like to share a story with you today. It's about a little boy who came to see me with his parents. The parents are busy professionals, and lately they have been disturbed by getting school reports about this little boy whose name is Ravi. Ravi is 7 years old. His class teacher has complained that Ravi cannot sit still in class. He is always fidgeting, he is always nudging his friend, taking away things from them. He will blurt out answers and he cannot wait for his turn. He will move round in circle in the classroom. He gets into fights with his friends and doing risky behavior like jumping on the fence and trying to climb into the trees in the playground. Mother also told me that it is difficult for him to focus on his homework. He cannot focus for more than 10 minutes. He will be distracted and he will daydream. She also tells me that he has always been like that a little bit from his childhood. Initially, when he was a toddler, they thought that it was just normal boisterous behavior, but they could remember fights in the nursery. So, is there a pattern emerging here? There seem to be some common complaints that he cannot focus on his lessons for a long time. He is very active, in fact hyperactive. He cannot sit still. He is always disturbing in the class. He is getting in fights with his friends, and also he is very forgetful. Mother mentioned that he had forgotten to bring his pencil cases twice in the last week. Is it a reason to worry? You may ask me, a lot of children do this kind of behavior. Why should we worry? It is right that a lot of children might behave like this when they are young. But as they grow older, especially around the age of 7 years, you would expect them to understand the basic rules of how to behave with other children in the playground and how to sit still quietly and able to focus. But this doesn't seem to be the case in Ravi. So what do we do next? So it is important to know, has something happened in Ravi's life that has changed his behavior? Children are really upset by something that has happened at home or maybe in school, maybe someone misbehaving with them. They do not know how to express it and it can come out in their behavior. But Ravi's parents are insistent that he has always been a little bit what they describe as naughty from when he was a very young boy. The parents want to know, is there something wrong? As I explained before, that a lot of children could be boisterous when they are young, but you still expect them to learn the rules to around 7 years of age. So if there is nothing else wrong with him, then we have to think, is there anything going on with Ravi? Now there is a condition which is called attention deficit hyperactivity disorder. It is self-explanatory. Attention deficit means someone is suffering from loss of attention very easily, and hyperactivity means that the child is also very hyper. ADHD is one of the commonest neurodevelopmental condition. What do we mean by neurodevelopment? So when the nerves develop or the brain develops, there is a neural network or many nerves developing in the brain. And the nerves talk to each other through chemicals. Now these chemicals like the dopamine and the norepinephrine, they are not present in the right proportion in the brain of an ADHD person. So there is a little bit of imbalance and there is a little bit of sensitivity in which the person will react to the environment. ADHD is also a biopsychosocial disease. In the biology, that's already explained in the brain. Psycho because it affects the mind. Social because there are a lot of societal factors which can cause or can worsen the features of ADHD. What could be these societal factors? A child, if preterm or if it has low birth weight, that can lead to ADHD in later life. If there is drinking or smoking in pregnancy, that can lead to ADHD. Finally, if there is a lot of strife in the family, domestic abuse, then the people in the home are also not following any discipline and boundaries. ADHD features, though they are not caused, but can get worse in such a home situation. Also remember, ADHD can run in families or it can be genetic. This is not me telling you all of this. This is backed by child research all over the world. So just to reiterate, the main features of ADHD are a child who will lose concentration very quickly, a child who is forgetful, a child who cannot keep still, daydreams, who may be impulsive and is a risk taker, and there can be other similar features as well. A combination of features that a specialist will look at, and will look at how long the features are present before giving a diagnosis. So it is important that if you think your child has got the features which are excessive in comparison to the other children of his age, then you take a specialist opinion. About 1/3 of children get cured of their ADHD once they are older, but the significant 2/3 will still have these features, and it is important that we learn to manage them in the childhood. Why is it important? Number one, because they are suffering in their education. If they cannot focus in the class, they are getting behind and they will not fulfill their potential. Number two, they are often getting into fights with their friends. They are not learning to follow the rules of discipline and the society. When they are older, this thing will continue and they can get into more antisocial activities. They can impulsively jump into actions before thinking through the consequences. Finally, ADHD children get blamed for a lot of things. So they begin to suffer from low self-esteem. This can later lead to a lot of other mental health issues. So it is important that we recognize and manage these well while they are still children. How do we manage ADHD? Experts worldwide have said that there are a few important cornerstones of management. Three of these are: number one, parent education and teacher awareness. Number two is behavior modification of the children. And number three, finally, medications. It is important to remember that your ADHD child is not being naughty. You will not get him to do the things you want him to do by just scolding him, because his brain reacts to the environment in a different way. So what do? You help him to modify his behavior. Brings us to number two. There are two ways. Number one is routines and reminders. That means that if you have a set routine for the day, it is easier for the ADHD child to remember that and to follow that. As he knows what is expected of him, he gets into a habit. If your children forget, then give them little reminders. This can be in the form of little notes, or it can set alarms on their phone as well. Next is BCDE for behavior modification. B for boundaries, C for consequences, D for discipline, and E for encouragement. What do I mean by boundaries? Now, there should be clear rules or boundaries that a child has to follow. What is acceptable behavior and what is not? And if he does not follow those rules, then there will be consequences. By that, I do not mean that shout at the child or physically punish the child. What I mean is take away something that he likes and he understands that that is a consequence of not obeying the rule. Like maybe not letting him go out, or maybe take his phone away, or not let him watch television. Next, we come to discipline, which means that if the whole household is disciplined, if there is a regular routine, then it is easier for the child to follow. Child will learn by observing the adults that he has got in his household. Finally, encouragement. Please do remember, they are also intelligent, or they are also talented children, but they lose their self-confidence because they understand they are a little bit different to their peers. Find the time to encourage them and tell them that they can. Don't let them get defeated. Tell them it is not their fault and praise them for their efforts. What behavior modifications can be done at school? Talk to the child's teacher. See whether the child can sit in front of the classroom before the teacher, or maybe not near a window where his attention will go to other things easily. Whether there can be small group teachings where he can get one-to-one attention. Do the similar thing at home. Spend more one-to-one time with your child rather than spending it on a phone or on the television or laptop. Divide her homework into small parts and let the child do the homework for 10-15 minutes and then give a short break where he or she can run around, spend his or her energy, and then come back and refocus again. Finally, make sure that the child gets a good nutritious diet and good night's sleep. which means that they should go to bed at one proper stipulated time and not have any screen time for at least 1 hour before that. A good night's sleep is important for a fresh mind to learn and follow the structure the next day. Now, if none of these things work, then please do take the advice of an expert. And just going back to Ravi, we are trying to get a school report by which we shall compare the symptoms that's been reported by school and the parents to see whether there is a mismatch or actually the same degree of problems are being reported in every situation. That will help us to come to a conclusion. I hope you found this session useful. Stay tuned for more and thank you for listening.